Hello everyone, it's Angelika Kargulewicz, clinical nutritionist, and today we will discuss what to eat to reduce the risk of colorectal, or in other words, bowel cancer development. Please stay with me if you are interested in this subject. The colorectal or bowel cancer is the third most common cancer worldwide. Unfortunately, the highest mortality from colorectal cancer was observed in Eastern and Central Europe. And for example, when it comes to the number of new cases of colorectal cancer, here, Japan, United States and China had the highest number of new cases in 2022. Environmental factors, which include lifestyle, including diet, are the major cause of the colorectal cancer. They are responsible for up to 90% of the cases of the disease. And the question is what to eat to reduce the risk of colorectal cancer. First of all, dietary fiber. Why is fiber so important when it comes to the protection from colorectal cancer development? Namely, it protects our colon cells not only by shortening the intestinal transit time, but also by shortening the time of exposure to potentially carcinogenic compounds contained in fecal masses. This is how insoluble fiber works, but also by fermenting the soluble fractions to postbiotics like short-chain fatty acids. And here we can say about butyric acid, acetic and also propionic acids, which have very beneficial effect on our intestine, not only by protecting intestine, but also by exhibiting the desired anti-cancer effect. The recommended intake of dietary fiber is more than 30 grams per day, and it is worth to mention that in some populations the intake does not even exceed 10 grams per day, which is very little. And it is also very worth to mention that it was estimated that our ancestors may have consumed even more than 100 grams of dietary fiber per day. Important sources of the insoluble fiber are whole grain, also wheat bran, wholemeal flour, but also the outer part of the seeds, grains, nuts, and of course fruits and vegetables. Important sources of soluble fiber are beta-glucans in oats, but also plantago psyllium and plantago ovata, and also fructooligosaccharides found in asparagus, artichokes, leeks, onions, garlic, also apple pectins, and also soluble fiber found in legumes. It is worth to eat whole grain products, which is a significant source of dietary fiber, mainly insoluble fractions, which shortens the intestinal transit time and prevents constipation. Sources are wholemeal flour and products derived from it, but also buckwheat groats, oatmeal, quinoa, brown rice, millet groats, and also sorghum. And here I will have a very important information, because even if you adhere to a ketogenic diet and eat no or small amounts of the carbohydrate, it is worth making sure that you have seeds, grains and nuts in your diet in order to provide sufficient amount of dietary fiber. Another important factor in order to prevent colorectal cancer development is the consumption of fruits and vegetables. They are a very valuable source of anti-cancer components such as carotenoids, vitamin E, C and also selenium. They also provide glucosinolates, indoles, flavonoids, protease inhibitors, plant sterols and limonene. It is vegetables and fruits that have 8 and 2 times the fiber content of the whole grains, respectively, per energy supplied. And in contrast to the cereals, vegetables and fruits provide mainly soluble fractions of the fiber, which have a beneficial effect on the human body, including the microbiota. Particularly recommended vegetables are those that are non-starchy. To a lesser extent, regular potatoes, because they are starchy vegetables with a lower potential when it comes to anti-cancer properties. But it doesn't mean that regular potatoes should not be eaten, as they are highly recommended because, for example, it's high satiety index. But when they are on the plate, it is worth taking extra care with non-starchy vegetables. In the prevention of the colorectal cancer development, it is worth eating starchy carrots, beetroot, parsnips, but also turnips, sweets and green leafy vegetables like spinach or lettuce. Highly recommended are also cruciferous vegetables like broccoli, cabbage, bok choy and watercress. And let's not forget about okra, artichoke, aubergine and also onion. And when I'm talking about onions, please not forget about the various colors of the onion, but also leeks and garlic. In order to prevent colorectal cancer development, we should also remember about eating variety of fruits of different colors like green, red, yellow and white on a daily basis, and on the whole we should consume at least 400 grams of vegetables and fruits per day. In the prevention of colorectal cancer, we should also remember about vitamin C, because an adequate intake of this vitamin has been linked to reduce the risk of colorectal cancer development. Particularly rich sources of vitamin C include black currants because they contain as much as 182 milligrams of vitamin C in 100 grams of the fruits. Also yellow pepper, they contain around 200 milligrams of vitamin C per 100 gram of this vegetable, and also broccoli, around 83 milligrams of the vitamin C in 100 grams of broccoli. Rich sources of vitamin C are also parsley leaves. They contain approximately 177 milligrams of vitamin C in 100 grams of the leaves, but also acerola, which contain around 940 milligrams of vitamin C in 100 grams, and some varieties of acerola even 4,500 milligrams of vitamin C in 100 grams. And also let's not forget about white rose. It contains around 500 to 2000 milligrams of vitamin C in 100 grams of the fruits. In the prevention of colorectal cancer, it is also important to consume legumes. They provide soluble dietary fiber, but also vitamins and minerals, so let's include in our diet, for example, beans, lentils and chickpeas. Calcium also has a well-documented role in preventing colorectal cancer, and when we talk about an adequate intake of calcium and the younger population, it is enough to eat around 1000 milligrams of the calcium per day. But when we talk about women aged 51 and over and men aged 66 and over, they need even 1200 milligrams of the calcium per day. Where we can find calcium? In the beginning, it is worth to mention that lactose and casein contained in dairy food products increase the bioavailability of the calcium. And in one glass of the yogurt, we can find around 340 milligrams of the calcium. One glass of the kefir provides around 200 milligrams of the calcium, and one glass of the skyr, which is Icelandic type of the yogurt, provides around 220 milligrams of the calcium. In comparison, 1 tablespoon of grated Parmesan cheese provides around 138 milligrams of the calcium. But note that cheese consumption correlates less than other dairy food products with reduced risk of colorectal cancer development. Fermented dairy food products are very advisable in the prevention of bowel cancer, not only because of the calcium content itself, but also because they provide lactic fermentation bacteria, also lactoferrin, which is immunocompetent protein, and also short-chain fatty acids like butyric acids. And they are very helpful when it comes to the prevention of colorectal cancer development. And it is also very important to remember that the individuals who consume less than 700 to 1000 milligrams of the calcium per day have an increased risk of bowel cancer development. In the end, ensure also that you have proper status of vitamin D in your body, because it is also very important when it comes to the prevention of bowel cancer. And also eat marine fish, at least 2 to 3 portions per week. Why this is so important to eat fatty marine fish? Because they contain very advisable polyunsaturated fatty acids, omega-3 fatty acids like EPA, eicosapentaenoic acid, and DHA, docosahexaenoic acid, which possess anti-inflammatory and anti-cancer properties. One placebo-controlled study showed that the administration of polyunsaturated omega-3 fatty acids at the dose of 2 grams per day for 6 months reduced the size and number of polyps in patients with familial adenomatous polyposis. In conclusion, as you can see, proper nutrition is very important when it comes to the prevention of colorectal cancer. Do not forget about dietary fiber, about whole grains, vegetables, fruits, but also about calcium, vitamin D and omega-3 fatty acids, which comes from marine fish. If you liked this video, please leave the thumbs up, subscribe to the channel, and you can also leave some comment in the section of the comments. Thank you for watching my video.